In March of 2010, a new healthcare plan was started to improve the health and well-being of Aboriginal people in BC.
Has anybody heard of the Community Engagement Hub? It's all about health. Has anybody heard of the Tripartite First Nations Health Plan? So when we talk about the Tripartite Health Plan, we're talking about a health plan that was developed by three parties. And the three organizations were the federal government, Health Canada mostly, the provincial government, the BC provincial government, and the BC Union of Indian Chiefs. But basically, what happened was about 6-7 years ago, they all got together and they said, you know what, there's a real problem. And the problem is that when we look at the health of the people in BC, it's like there's two separate groups. Over here, we have your average British Columbian, and their health, they've got some problems, but generally speaking, their health is pretty good. But if we look over here, if we look at just First Nations people, it's not the same. There's a huge gap between the health of the average British Columbian and the health of First Nations people in general. They decided to start working towards a plan to close that gap so that at some point in the future, the health of average British Columbians will be the same as First Nations peoples. So in order to do that, they decided it was going to take a lot of work and they needed lots of people involved. And so the federal government was on board, the provincial government, BC Union of Indian Chiefs was on board, and they decided that they needed some organization to sort of head this up. And they created the First Nations Health Council. So the First Nations Health Council represents all of the First Nations in BC in lots of different areas around health. The First Nations Health Council decided to create community hubs as a way to make sure that all First Nations people in BC had a voice in creating their own health plans. There are now 26 community engagement hubs across BC, and they represent 160 First Nations. So the vast majority of First Nations people in BC now have an opportunity to take part in this planning process. So over the next 10 years with this tripartite health plan, what's going to happen is the responsibility for health is going to be transferred over to First Nations communities. So however it is right now that we don't like, now is the time to try and make some changes around that. So going out and finding places where people are already gathering is something that we want to really focus on. The other thing that we're doing is we're setting a committee up. We have to have a hub committee because it's not about what Betsy and I think should be done. It's what community members really, really want. And the hub committee needs to represent all 11 of the Stolo Nations. Okay? And most importantly, on that committee, we need youth. We need elders, and we need youth. So we have lots of different ideas to sort of put out there, but we need people to sort of get involved first so we can do that work. And what we've been asking people is to share their vision of what health looks like and sounds like and feels like for them. And we're sort of using that as a starting point, as a jumping off